Everyone, it's great to have you here. I'm Teresa Youngkin, and I'm passionate about helping healthcare leaders stay ahead of the curve when it comes to new technologies. And I do that by simplifying technology concepts into business-oriented language. So whether you're struggling with data initiatives or you're just trying to make informed decisions about bringing in new technology or dealing with the constant changes in the market, I got you covered. Welcome, and I'm glad that you could join us for this wrap up episode on generative AI. If you haven't been here before, my LinkedIn channel, I talk about all kinds of different types of technologies that affect healthcare because that is my specialty. I'm a healthcare informaticist. We've spent the last 12 weeks, so our summer session has been on generative AI. If you want to see any of the previous episodes, you can find them here on my channel. Now, I'm going to give you a quick overview of what we've talked about over the last 12 weeks about generative AI. Now, we've covered many topics from the benefits of AI providing cognitive offloading for anybody in the healthcare system to real business considerations that every leader should be aware of and to consider when investigating AI for use in their organizations. Now, AI, or artificial intelligence, is a transformative force and it's actively reshaping the healthcare landscape and beyond healthcare. It provides and it promises a revolution in patient care, cost efficiencies, and administrative streamlining. Now, as organizations consider integrating AI into their operations, these key areas must be addressed if you want to ensure business operation efficiency and success. So, here are my thoughts about the state of healthcare in the next few years when it comes to generative AI. I do believe that AI is going to be a catalyst for a change in healthcare. AI right now is enhancing efficiency, it's alleviating some of the workflow or the workload of healthcare professionals in a workflow. It's been driving innovation and it's improving patient outcomes. Well, it's been addressing a lot of the challenges that we've been talking about in healthcare, such as how do we address disease burden, long waiting times, clinician burnout. At the end of the day, how do we make healthcare more accessible and tailored to each individual's need? The next thing has been the advent, and it's going to continue, is machine learning and that deep learning. Now, these are the real cornerstones of using generative AI in your organization. Now, these integral components of AI are aiding in predicting disease outbreaks now. It's helping to construct models for complex health issues, and it's been utilizing natural language processing or NLP to interpret clinical paperwork. When you're able to do that, you can elevate the standard of patient care. And we all know that clinical gold is in the unstructured data. And when we get to using AI, that gold will be unlocked in the unstructured data. Next, we've got remote patient monitoring. And it's going to have a significant role, AI will. It's going to be pivotal in remote patient monitoring or RPM. It's got the ability to analyze extensive data from remote devices to offer insights that are going to influence our treatment outcomes. We know that the volume, the veracity of the data that's been coming in from remote patient monitoring can be very cumbersome to analyze. And so when we get the synergy of RPM and AI, it's going to start to bring forth more improved patient outcomes, personalized treatment plans, cost reduction, revenue augmentation. It's really going to contribute to a seamless healthcare experience, both within the organizations and outside of our organizations. One thing that we're going to start to see is more patients recovering at home rather than in the hospital or in step down units. And my family had the opportunity to participate in one of these programs earlier this summer when my father had double pneumonia. It's very interesting to see. All right, AIoT, new acronym because we love acronyms in healthcare. This one is going to be a convergence for proactive healthcare for us. So, what's AIoT? It's the integration of AI with the Internet of Things. And right now, it is transforming our smartphones into health detection devices. It's enabling more timely health issue detection and fostering more proactive interventions through intelligent patient monitoring. For example, had this happen many different times, right? Your smartwatch. If you are stressed out, it will tell you, it will buzz you and tell you to breathe. Sometimes what ends up happening is that it'll tell you that you've had an abnormal heartbeat, things that you need to be thinking about, right? Like it's right there. Again, this is also a real challenge, and it has been a challenge for healthcare organizations. Is again the volume and the veracity and just the sheer amount of patient-generated data that has been coming in or that's available. It's just going to increase with the more devices that come out there. So AI is going to allow us to analyze that data that's coming in a larger quantities and to create more analysis around all of that data. And what we're looking at to do is to pinpoint some of those signals in disease states earlier and earlier rather than later and later when it's too late to do anything about it. So, very excited about that. We've already known that AI has started to revolutionize surgery and administrative tasks. So, AI is starting to make strides in surgery with robots that are assisting in complex procedures. It's been enhancing precision and also reducing risks in surgery because we know risks are where we really want to mitigate in this work in that particular workflow. Now, additionally, AI's application in those administrative tasks, such as health records management, rev cycle management, it's starting to streamline a lot of the processes and having AI available to do quality checks, of course, with humans first monitoring the processes, it's going to start to minimize errors. It's going to improve our data quality. And therefore, again, that all rolls down to patient care. Virtual assistants, that's going to be the next step in telehealth. And we're starting to see it already because there's been this emergence of AI powered virtual assistants, and they are making significant steps in using telehealth. And it's starting to evolve telehealth to a new level. So, AI can offer automatic reminders, health education, and it can also act as a liaison between service agencies and healthcare professionals. When I think about this, it's really going to start to benefit, and we've seen it benefiting individuals with cognitive impairments. And I don't know if you guys saw the latest article about what's coming out around AI and new implants, but it's a little bit just really mind boggling what's happening right now. If we're going to look ahead, we need to just think that AI is going to continue to be here and it's going to continue to advance. And the upcoming years, we're going to see a lot of really dramatic shifts in healthcare, and it's going to be around electronic health records. It's going to be around chronic disease management, algorithms, and there's also going to be this amalgamation of AI with other technologies. It's not just going to live by itself, it's going to augment and come into development of new products out in the market. We do know that companies that are innovating at the forefront of healthcare, they're offering like comprehensive virtual care systems that are designed to enhance patient outcomes and to create diverse revenue streams, right? They are creating win-wins for the provider and the payer. And again, that results in improved patient care. When everybody's benefiting, that's when we get adoption. So, what are some key considerations for organizations who are going to be implementing AI? And I've talked about this over and over. Number one is always strategic alignment. Organizations should ensure that their AI initiatives align with their overall business strategy and their objectives. Now, this is going to involve identifying key areas where AI can add the most value and contribute to achieving your organizational goals. Next, we're going to talk about data management and quality, and this is like near and dear to my heart. When you have effective AI implementation, it's going to require access to high quality, relevant data. And organizations are going to need to invest in some robust data management practices to ensure data accuracy, security, and compliance with regulations. We talked about regulations that are coming down the pike last week. Talent acquisition and development. We talked about this a couple of weeks ago when we talked about the effects in business processing, right? Building and maintaining these AI systems is going to require some specialized skill sets. Now, organizations should be focused on acquiring the right talent and providing continuous learning opportunities for those who are already in your talent pool to keep up with the rapidly evolving AI landscape. Again, I talked about this weeks ago about how we should be utilizing all of that institutional knowledge that our middle level managers hold and have them be a part of these AI initiatives within our organizations. What a 1-2 punch. Next, ethical considerations and bias mitigation. Again, this is my soapbox always. The ethical use of AI is paramount. Organizations should be establishing guidelines and practices to address these ethical concerns and mitigate biases in their AI models to ensure fairness and transparency, especially when it comes to projects or initiatives around health equity. These AI models need to have the right data fed into them so that we are not perpetuating any biases that are happening. Scalability and integration solutions need to be scalable and they need to be easily integratable with existing systems and workflows. If we've learned nothing from EHR implementations from way back when in 2008, 2009, we know that if we're going to have seamless adoption or at least low impact adoption, we need to be working within existing systems and workflows and having those that are boots on the ground have their voices heard in the design of these systems, right? When we do that, we know that we maximize the benefit of any technology across the organization, and AI is no different. It's really important that we are being thoughtful about how we go about this and we don't forget the lessons of the past. Lastly, we're going to talk about ROI measurement and monitoring because at the end of the day, your CFO is going to want to know what's it going to cost and what value is it going to bring when it comes to the dollars and the cents. So organizations should establish clear metrics and KPIs to measure your return on investment of any AI initiative, and you need to continuously monitor the performance and the impact, because right now we're seeing that it is running like this, kind of like at a steady pace. People are seeing, they're experimenting. It's going to go parabolic, which means that it's going to shoot up really fast, and then we're going to start to see a leveling off. And when does that return on investment mean that when that return on investment starts to decline, that's when we need to start to innovate and to monitor and to start thinking about what's next in our strategies. So it's going to be really interesting to see what's going to happen in the next couple of years. I do believe that this is going to be it's going to have a significant impact, and it's going to be a great time to be in healthcare. Well, in conclusion, as you can tell, I'm an advocate for it. AI is actively transforming healthcare. It's offering personalized, efficient, innovative solutions right now. And as any organization considers the integration of AI, always address those key areas. Make sure that you're addressing your strategic alignment, data management, your talent, ethical considerations, your scalability, your ROI measurement, because if you don't, you won't be successful. And at the end of the day, we all know that we need to be successful. Lives depend on it. And as the continuous evolution of AI happens, we need to be thinking about what's going to be coming next, because it really is going to usher in more groundbreaking developments. It's going to ensure that healthcare and organizational operations are not just services, but these are going to turn into some really personalized and efficient experiences for everyone in the healthcare ecosystem, whether you're a provider, whether you're delivering some sort of healthcare, whether you come adjacent to healthcare, or whether you are a receiver of healthcare. We're going to see that the work and that the workflows and the outcomes are going to be a lot more personalized, and it's going to happen a lot more efficiently if we use AI the right way. So, thanks for joining me, and I'm going to be back here again next week, and I'm going to give you an update on the recent Fire Connect-a-thon and what's new in the standards-based interoperability space. I was going to do it this week, but my gosh, we're already, we're longer than I think I've ever done before, but this is such a huge topic, and it's important that I take the time, and thank you so much. You guys have a great week, and I'll see you here again next week, next Wednesday. All right, take care. Peace.